Beef Heifer Development, the breeding phase, lesson 5. Ideally, we would breed heifers 20 to 30 days ahead of the cow herd. This allows for a longer postpartum interval of heifers. And typically heifers on that first calf, it takes them longer for the reproductive tract to get back into condition. So that's the reasoning for breeding them ahead of the rest of the cow herd. It also allows you to focus on this group during calving. A young bull is likely to cause less injury if you're using natural service, and you can palpate about 60 days after removing the bull to see if they're pregnant. Now, traditionally, a small bull is used perhaps in natural service, but what impact on weight of the first calf does that have? The accuracy values of their EPDs of the young bulls are very, very low. An alternative would be using growthy, easy calving bulls with high accuracies on yearling heifers through artificial insemination. And that is an excellent option of using a proven sire through AI. Well, heifers can be synchronized to conceive earlier in the breeding season. Calves born in a shorter amount of time results in a more uniform calf crop that has certain marketing advantages at weaning time. Synchronization programs exist that can initiate cycling in heifers that would otherwise might not get bred. Tools for estrus synchronization, well, you need a good corral facility. And the products that we talk about here, progestins, like MGA, prostaglandins, gonadotropin releasing hormone, or some combination of these. We're not going to talk on all the different systems, and we'll just talk about a couple of them here in this presentation. But one system for heifers is using MGA and prostaglandin. MGA is fed at 0.5 milligram per head per day for 14 days. Now, it's important to have the MGA mixed well with the supplemental feed, and it's also to have adequate bunk space for all heifers to eat at once. This is basically a diagram of the program. You feed the MGA for 14 days. There's a subfertile heat. We don't breed on that. Then a time later, prostaglandin is administered, and then we breed on that subsequent heat. So essentially, all cyclic females and some anestrus females will exhibit estrus within a week of the withdrawal of the MGA. But this is a subfertile heat, so don't breed or inseminate on it. A single injection of prostaglandin administered 17 to 19 days after MGA has been withdrawn is the system. The 19-day interval may yield in a more precise estrus response. Most females will show estrus 48 to 72 hours after the prostaglandin injection. You can inseminate 12 hours after detecting that estrus. So one of the most common approaches is you check heat for 5 to 7 days after the prostaglandin administration. An alternative is a timed AI program for all females or those that have not displayed heat by 72 hours after prostaglandin, which often results in acceptable pregnancy rates. An alternative method is suggested in the lesson using MGA and prostaglandin for cows and 2-year-olds. Now, another system is the use of a seeder with timed AI. A seeder is a device that's placed in the reproductive tract, the utilization of prostaglandin, and then timed AI after the administration of prostaglandin. The seeder is relatively easy to administer, just placed in the reproductive tract. You get excellent synchrony of heat, results in normal fertility, and induces anestrus heifers to begin cycling. It's somewhat more expensive than the MGA prostaglandin system. It may be more variable in results. However, overall, it does have acceptable reproductive rates. If you're really concerned about whether a calf came from AI or a cleanup bull, a trained technician can detect pregnancy as early as 28 days after AI or natural mating. Traits to look for at culling of heifers. Heritability estimates, fertility, say pregnancy rate, are relatively low. However, it's so economically important, it can't be ignored. Therefore, culling heifers that fail to conceive within a set breeding season should enhance overall cow herd fertility. Calving ease, as a rule of thumb, bulls having a birth weight EPD within the 15th percentile of their breed can usually be considered calving ease sires. Milking ability, fleshing ability. Within a breed, certainly consider using milk EPDs. You can crossbreed with a sire from a heavy milking breed. Optimum body condition score should be a 5 to 6 on a 1 to 9 scale. So they should be able to maintain that body condition and as long as they can maintain that milk production. Temperament is important as well, and it's relatively highly heritable. Cull heifers having poor dispositions because they create problems in the rest of the cow herd. Muscle thickness, select heifers that avoid extremes, and that will be optimum. Structural soundness affects longevity, so look at their feet, their legs, eyes, jaw, and udder in evaluating structural soundness. Some suggested guidelines, and these all they are guidelines. And we won't look at all these numbers, but let's look at weaning weight. A minimum weaning weight for a moderate frame is 425. For a larger frame, minimum 500 pounds. Minimum yearling weight for these moderate frames is 600 pounds. For large frame animals, 750. We want those animals to be ready to breed or go through puberty at 14 months of age. Pelvic area. If you're having calving difficulty, you might consider measuring the pelvic area of animals. These numbers are a minimum. You do not look for maximums. You don't select the heifers necessarily that have the biggest pelvic area. You're just trying to get rid of any calving difficulty. But anyway, the minimum pelvic area of probably 160 square centimeters at breeding, and then 190 square centimeters for these larger frame. A minimum body condition score at breeding is a 5, maybe a 6 with heifers might be considered. Minimum weight at breeding, once again, we talked about target weight concept depending on their frame, looking at where that frame score and temperament being calm. Well, 2-year-old heifers should weigh about 85% of mature body weight at first calving. We talked about 65% for puberty. Well, now we're talking about calving. They should target for about 85% of their projected mature body weight. If on target for puberty, heifers should gain about a half to a pound a day from breeding to calving. Now, they may reach those targets coming off good grass in the fall, and then you're just trying to maintain them through the winter. They should have a body condition score of 6-7 at calving on a 1 to 9 scale. Well, energy requirements from breeding to calving. A target gain of 0.5 for 9 months, that's about 135 pounds. You want to monitor body condition score. So if you've got a spring calving herd, they may be on pasture. The first 5 months of gestation, that's June to November. Maybe they'll have some hay in January, December and January. And you might consider, based on forage analysis, they may not need any supplement at all, probably maximum of hopefully no more than 7 pounds. You don't want to be at high levels. Fall calving, hay is fed the first half of gestation, December parts to April. Then they're on pasture from May to July, and then they may have pasture and maybe a maximum of 5 pounds of a supplement if needed. What if they are fat? Well, grazing season could be extended with protein supplementation. However, this is not a time to put them on a diet, certainly in late pregnancy. Thin heifers have lower levels of colostrum. We talked earlier about how their fed affects the quality of the colostrum, and heifers that are thin at calving have more calving difficulty. The problem with making them lose weight when pregnant: inadequate nutrition creates more calving difficulty problems than excess nutrition. Limiting nutrient only slightly affects calf birth weight. Heifers will sacrifice body condition and growth before affecting the fetus. The result will be increased postpartum intervals if they're in low body condition. Nutrition can get a lot of blame for what was perhaps an improper bull selection. Excess energy can increase birth weights, but not an excess of protein. So if protein supplementation is needed, certainly consider it, but don't expect it to really increase birth weights.